We want to figure out a way to protect the vulnerable. The medical tradition, the Hippocratic Oath, our own sense of moral decency requires that we help those who are in need. And on the other hand, there are all these countervailing values that get activated once you start thinking about how you set up a system to do this. How to create such a system that doesn't bankrupt you on the one hand and has a moral foundation that makes sense within the ethical traditions of our own country. And that's what we're struggling for, because we have so many conflicting moral principles. One of the complexities, many complexities surrounding debates about health reform is that the health concept in a society like the United States has the potential to be a weapon against diversity, because it has perhaps become the core religious concept in our society, and bodily health seems like it's an objective standard that can be used to require surveillance, regulation, and transformation of cultural practices, especially if any of them are shown to be costly with regard to health outcomes. If you think that one of the purposes of the state is to help protect human freedom, and that autonomy, self-reliance, and personal responsibility are values, then if you also think that pre-existing conditions should not be a qualification for being part of a health insurance system, you're clearly going to have to mandate that everyone be in. If you start having requirements of that type by the state, that doesn't look so consistent with autonomy, freedom, liberty, and so forth. So people who are big on small government and personal liberty and responsibility, you can understand where they're coming from, at least, when they say this is going to reduce our freedom. Then there's this other dimension, which is, are we really all in this together? Is that the way in which people feel? Is that the kind of attitude people have towards one another? I've often thought that the European nation states, where they have national health systems, have a history of being relatively homogeneous peoples who may well, precisely because of their nationalism, the sense that they actually view the state as an extension of their national identities, their ancestries, their ethnic and religious heritages, and they very naturally think of the state as just being the instrument for promoting their particular group's interests, can have a relationship to national health care that's a bit different from the United States, which is a much more multicultural society and isn't nationalistic in the same sense as these European countries, because in the United States we're not really a nation state. We're more like a state-based nation. We are tied to each other by our dedication and patriotism towards our Constitution, but we don't require common religion, common ancestry, common culture. And in that sense, we may not feel like we are in this together in the same way that a family might feel they're in something together.